everyone to the SSMA Center presentation on the physician's role in protecting patient information. This presentation is brought to you by the Center in partnership with MMIC. Please, we're going to keep all phone lines open, so that way if you want to ask questions, you're certainly welcome to, and we encourage you to do that. If we do pick up a bunch of background noise, we'll go ahead and mute the lines, but we'll let you know if we do that, and then we'll take some time throughout the session to open them up for questions. So we'll plan on a Q&A period or time at the end of the program. At this time, I'd like to introduce to you Trish Luktu, MMIC. Trish is presenting to healthcare leaders across the Midwest and creating awareness of topics immersed in the intersection of technology and healthcare. Trish received her Bachelor's of Science from the University of Minnesota and is certified in Healthcare Information Management Systems, HIPAA, and computer programming. Trish has a passion for learning and is truly an expert with respect to medical privacy and patient information. So I'm going to turn it over to Trish and ask her to lead us through this presentation.
Thank you, Rich. I'm very happy to be here. What we're looking at today is the physician's responsibility in protecting patient information. So what we're going to try to do is look at the top 5 causes for breach and their causes, learn safer practices for the physician behaviors that increase the cyber risks, and then also understand how we can support our organizations in compliance to minimize those risks. So I'm going to give just a very brief background. When privacy came onto the scene, it wasn't new. It was a new idea. It was as old as the Hippocratic Oath and Hippocrates himself when he started the practice of medicine. What was new was that security was sort of a digital revolution. So this is where we find ourselves. If you take a look at this graph, you'll notice that this has been happening within the course of our lifetime. We've been immersed in technology, and sometimes it just feels like a tidal wave that's washed over us. It's very pervasive. We can get away from it. Technology doubles every 2 years, according to Moore's Law. And really what that means is we can do more, and we do it faster. Internet use. Internet use has grown since it came on the scene in the 90s. It was 77% today in the developed world. We also see tremendous growth in storage. We have so much data in digital format now. And look at what that impact has been on healthcare. It's nice that we're seeing the challenges in place. We've got phone apps. We've got PACS for imaging. We've got EHR portals, HIE, everything surrounding those, and a lot of data. Use it at some level. But we're still fighting this perception that security is a problem. But it's really the case. Here's how I'm going to spell this out. I like this quote by Bruce Schneier, who is an internationally renowned security technologist. If you think technology can solve your security problems, then you understand the problems, and you don't understand the technology. It says it really quite well. And it points to what I'm trying to make, which is who is really responsible for security. New way to look at security. And just bear with me for a second. This is the history lesson. This started back in post-World War II in the coal mines in England when they started introducing machinery in the workplace. They talk about socio-technical systems as a complex organizational work design that recognizes the interaction between people and technology in workplaces. Well, this is the way that we look at EHRs today, or security. It's the same thing. It has many components to it that if any of these components aren't nurtured or paid attention to or grown, it can act as the weakest link, and you'll have a hole in your security, so to speak. People behaviors very much affect security. What you do with your information, what you do with your devices, what you do with your paper records. impact security. Regulations, it's very important to notice that it's not just HIPAA and the federal regulations, it's also the state privacy laws. This is where I say technology is really a small part of security. And yes, it's important. It's very important. But if you look at all of the components that make up security, it's just a fraction. So let's look at what that means to be breach and cyber liability. For HIPAA, which is a federal regulation, talks about an impermissible use or disclosure. It has to compromise security or privacy of the protected health information. It poses significant risk to the affected individual, and it has to have some sort of financial, reputational, or other harm. Now, for omnibus legislation, it's tightened out a little bit, and I'll talk about that in a second. So about cyber liability, side of the coin, we're talking about the risk or loss of exposure associated with data privacy breach. So things like cyber liability coverages, it a whole array of protections. There's security and privacy liability, there's regulatory defense and penalties, privacy breach response costs. So there are these things that make up both direct and indirect aspects. And you can see that each of these things is going to impact somewhere on that system of security. The cost of healthcare data breaches, it boils about $316 per compromised record. It has to be the highest cost across all industries in the U.S. But when we look at the cost of both direct and indirect that make up a breach, that these are what we see. When at the majority of the cost, it's an result. It's the lost customer business. Second one is legal services or defense. So then be indirect response to the breach. Investigations and forensics is another reaction to breach. Customer acquisition cost is another direct cost of breach. So you can see that some that are directly impacted by breach, like the legal service compliance, and consulting services, inbound contact costs, those are a lot smaller than the long-term indirect costs. How many people does this affect today? Well, it's up to, and I just updated these, so we're up to 30 million 400 people affected by breach, and these are only the ones that are reported to the Office for the Office for Rights on these breaches with more than 500 individuals affected. About that, when you compare that to the whole U.S. population, it's about 1 in every 10 people is affected by a healthcare data breach. Environment, we also have increasing public awareness. I added the Target logo to this slide just recently in response to their huge data breach. Facebook is in here. Google is in. We have things like Privacy Week. We have Privacy Summit. These are new in the scene within the last decade, and public awareness of privacy is really rising. It's leading to things like increases in complaints. So, for example, you can see a graph from 2003 to 2013. There's a general trend upward, and we total of over 88,000 complaints to date. In the Health and Human Services Office for Civil Rights also tries to make it really easy, even on site. Anyone can file. Regulation that's supporting this tech that was finalized in the omnibus rule. Enforcement was increased civil money penalties, associate compliance, audit program, and other things. We're up to about 84,500 resolutions. And what resolutions look like are this. Have about 62% of those resolved are resolved after intake and review. 6% end in corrective action, and we necessarily hear about all of those, and have about 12% of those ending in no violation. And that, if you look at between 2012 and 2013, the no violations are getting smaller. Is getting smaller. So, example of a breach that was in the press in December. We had a oncology practice settle potential HIPAA violations. A $150,000 payment was made by a practice of physicians with 6 mid-levels. Small practice with pretty large fine. I want to explain there is the word potential, because most folks I run into don't really understand the difference between these resolution payments and the civil money penalties and how those are. So first of all, a resolution agreement is a contract with the Department of Health and Human Services. These can sometimes occur 2 to 3 years after the breach, because what happens is you have a corrective action plan that comes with this resolution agreement. You have obligations for compliance and burdensome reporting requirements. So you're reporting back to HHS and CR 2 times 3 years in length, just to make sure that you're indeed following up on your compliance. Resolution payment that we see in the news, this is a payment reserved to settle those investigations with more serious outcome. So they aren't in response to the actual breach found, but to potential breach, meaning that you're going to basically finance the OR to investigate the breach that happened. When all is done, and the resolution agreement has reached its term, they decide to civil money penalties for noncompliance. So if you don't meet the terms of your agreement, you can get money penalties on top of that. Examples on the HHS website where they use as case examples. They're trying to hit a wide variety of examples, show that we have large, we have state government, we have universities, we have insurance companies, we have pharmacies. So it's trying to show examples of the fact that no one is insulated from this. What's the point of the civil money penalties? Now, there are a couple of cases where choose not to impose a civil money penalty, and that happens with if you have higher due diligence and you correct it as well as you can, they can waive those CMP. So the left side of the screen is due diligence. The higher you go, the higher you do due diligence is, and as fines correlate, it's a lower fee per. That said, the State Attorney General, regardless of the type of violation, can still impose a maximum, which is $50,000 per violation, and they build this up to 1.5 per million, or being up to 1 year if it includes criminal activity. Best rule did last year was it wanted to create a more objective definition for breach and how they consider or what they consider determining the civil money penalties. So they now define it as the number can multiply based on the number of individuals affected over a time period. So, another point for each day, because a breach can occur over a period of time. They look at history of prior compliance, history relations, and look at the financial condition of the covered entity to see how much they can bear. And then other matters as justice may require if there's any legal issues. And in case example, there's actually only one organization on this chart that received any civil money penalties, and why it was so high at $4.3 million. They just ignored the OCR's request for any information, and so for 2 years, as they ignored it, their fees multiplied. Okay, so let's get to the meat of this. What are the top causes of breach, and what are roles in protecting that information? So the first to say is there is no magic key to avoiding breach. It does take a full compliance culture that's iterative, built on documentation or policies and procedures, finding that responsibility and making sure someone has oversight to keep going. You need to make sure your workforce is trained, that you're trained, that you need to make sure that you're keeping communication open, that you are soliciting feedback, and you're also enforcing those policies and procedures that your organization has developed. Then you have to make sure they're being followed and remediate any issues that arise. Adjust your policies as you put new technology in. Make sure that they're still valid, and so it begins again. Here's an example of a physician group in 2012 who were fined $100,000. Their risky behavior was willful neglect. When we looked at the rate of civil penalties, as it went lower, the fines increased. So, by physicians, a pretty hefty fine for a resolution plan in this case. What they did was they had pay appointments on an internet calendar. Some Googled themselves and found their information out there. What this is to illustrate, again, there's no magic key, but create that culture of compliance, responsibility, so on and so forth. Top data breach are green. So we have theft, loss, hacking, unauthorized access, and unauthorized disclosure, improper disposal. When we look at the number one, which is theft, 50% of all of those patients affected, so 15.8 million people were affected. What was stolen? We have, it's been stolen. Laptops, portable electronic devices, servers, desktop computers, electronic media, and paper. Of a hospice of North Idaho. This one last year in January. We had a hospice with 12 beds, and we had one of the providers going between a few facilities and stopped between missions, and top was stolen from the car. We hear a lot, and that's because it's a common occurrence. The laptop was unencrypted. They only had 441 patients on the laptop. $50,000 settlement. So the behavior is he didn't keep laptop securely out of sight when left unattended. What's safer is when you're moving between locations and you have a laptop like this, hide it out of sight if you're in a pickup truck, or lock it in the trunk before you leave to go to the next destination. It's also I can't say this one enough, but encrypt your hard drive with a strong password. There's such thing as a safe harbor rule, where it's encrypted with the acceptable encrypt methodology. It's not considered a breach, and you're in safe harbor. It is considered unrenderable. When we talk about data on the move, you have to make sure you are accountable for its physical security, know where it is, and have IT folks help you to make it more secure, to encrypt it. But only help if they know about it. So if you're doing things under the radar, bring it up You're taking stock of where you're collecting electronic PHI, to how you're transporting it, and help identify it, and then support the decision to encrypt. And top in law is loss, 24%. This represents 7.5 million people affected. Well, lost and the stuff that gets stolen. In this example, we have Massachusetts General Hospital. They had $1 million settlement, 492 patients. And what happened was a worker would actually left the patient's schedule. And I've heard this scenario, with physicians, their staff. So it could be anybody. They left the patient's schedule on a subway train during the commute. And not was it a patient schedule, but was from the infectious disease outpatient clinic. And so there was also sensitive information included in the schedule. And it had quite a bit of PHI on this schedule sheet. The behaviors are compliance of the policy for removing PHI from facility. There was a lack of physical safeguards. So when we talk about some of those risky physician behaviors that can increase cyber or privacy risk, these are the pieces where we need to really monitor, make sure what we're doing is not putting ourselves at risk. Aware that these can be issues, and to the folks that can help find solutions. Move electronic systems. You should be able to access these schedules where they can be kept securely. The point here is, make sure you're supporting your culture of compliance. Don't greatest risk. People want you to lead example. So make sure that if these policies and procedures are hindering you from providing the quality care, then you need to also engage in creating a better solution. It's okay to ask why we have this policy, and ask why does it make sense, and why can't you do something else? But better to do that than to just go ahead and do it anyway and fall under the radar and not bring these to the surface. Well, third largest breach, we've got hacking. So this is one that is only electronic data. It's quite tremendously in the last couple of years. We're up to 2.6 million people affected. And if it's on an electric device that's connected to a net or a network somehow, it's the type of thing that gets hacked. Some new news release just this month, a couple of weeks ago. It was the largest HIPAA settlement for potential violations at $4.8 million. It was a responsibility between New York Presbyterian Hospital and Columbia University Medical Center, where the faculty of Columbia University were contracted as the attending at New York Presbyterian Hospital. This case is where we have an IT staff physician with do-it-yourself solutions. So they had he had a server that plugged in, but into the network, but was not a secured server by the IT folks. So got the better of him, and they ended up having a breach of quite a large amount of people. So practices would be coordinate with IT. You empower your IT staff to share their expertise so that you can do yours worry-free. Support organizational efforts to create technical security. It's very important to understand how to coordinate that, and definitely use a trusted technical advisor or resource to do your technical security. fourth breach type is unauthorized access and disclosure. So I think I have there, it should be 7%. But with access, 2.1, 1.2 million people affected. Access, ER, paper, mail, email, computer, laptop, anything that you can see PHI, that's what's accessed. Example of the Methodist Dallas Medical Center had a potential breach due to an internet-based email. It was password protected, but not meeting the standards of the organization policy. And here's one that I see a lot of physicians pressing, which is using their own email accounts. They don't see a lot of physicians who like to minimize the number of emails they have. Like to use their personal one. It's connected to the phone or the smartphone. What happens, again, is that they're not managed. So it's a do-it-yourself email solution. They have weak passwords. They might be unencrypted. And for practices would be to support strong passwords. By policy, don't use personal accounts. And if you were emailing with other providers regarding patient information, then look at an encrypted solution. Now, here's what I'll say about email encryption. One has every right to email with a covered entity, physician, hospital, staff member. If they want to provide their patient information in an email, that's completely fine to do. They don't have to encrypt it. It's their information, and they can do whatever they want with it. I would initiate emails with a patient. If the patient emails you encrypted, let them know that this isn't secure, and they can still agree, and it's fine. When it's in your possession, when you are accountable for it, it's on your phone, and you have a phone that's not secured, and you lose that phone, all of a sudden you have email phone that's being exposed, potential breach. It's clear or scenario, because if it's your possession, you're responsible for it. If you're emailing with another provider, it's up to the patient how you do that and why you would want to encrypt those types of messages. The last thing about email, though, is that remember, if it belongs in a medical record, it needs to go in the medical record. I've seen cases where people got into trouble in claims, in malpractice claims. They have information on their phone that was never sent or inserted into the EHR. Here's an example. The Utah Department of Health. Weak password on their system, and that's how someone was able to hack in. So server with a weak password, 780,000 patients were affected. We're talking about large-scale breaches. Support those strong passwords. And also share passwords. I see a lot of, but I see enough physicians who share their passwords with their medical assistant or nurse to say, you know what, go log me in so it's ready for my patient to come, and it'll be ready and waiting for me. Remember that your serving is your signature, so anything that is attached to you, your ID, that's what is whoever needs to know in that metadata behind the scenes that was you doing whatever it was that was done. So that you understand that shared passwords can also impact the integrity of your medical record. About what password strengths. I want to explain this a little bit too. Two concentric circles, EHR and internet. When you're talking about a web-based EHR, and EHRs like Greenway, eClinicalWorks, those types of web-based EHRs, if you will, there it becomes very important to have a strong password. You have one layer of security between you and your EHR. One computer, an EHR that's behind a remote desktop, that's on a computer, that's behind a network, that has a firewall and VPN, you have many layers of security. And so if you at least one of those layers have a strong password, the rest can be backed down a little bit because who you are protecting your login from is your coworker, and there's understandably already a level of trust there. So there's a difference between where you need greater password strength and how layers in. Now, I have a complex password, complex security layers like left. There are reasons why you have to have strong passwords. So, for example, you may not have all of those layers of security at every point on the network. In your exam rooms, or leave your terminal server or Citrix open. So then you have one layer of security to your EHR. It's things like those that you have to look at with all the nuances. Breach that I want to talk about is improper disposal at 2%. So this is about 709,000 people affected, and what was improperly disposed. Again, basically anything that can be thrown away. For example, this was a smaller lab that had a storm town, their basement flooded, and they crew come in, including pulling one of the lab computers that had many patients, I think over 100,000 patients, 55 patients affected by a discarded computer. Now, here's a point I want to make about this. The computer to the dump, it was discarded. It wasn't likely that they had anything happen with the data, but HIPAA doesn't care. They still see that as a breach because you still don't have accountability for that data. So I'm going to make that point of it's whether anything happens to that data or not. In this case, though, is increased awareness, just making sure everybody understands responsibilities, making sure everyone understands that they're a risk manager and that they're all accountable, and if they know that there's patient information somewhere that needs to be protected, this is a case where they need to continue to do that. A little one slide on mobile devices. Are such a special case, and that's why you see so much in the news, in the journals, on the internet about them. Mobiles are vulnerable to all of these 5 types of breach, right? So they can get lost, they can get stolen, they can get hacked, and we see in the news as well with celebrity phones that get hacked. They can get accessed with unauthorized use and disclosure. Hey, can I borrow your phone for a second? Sure, we see that all the time. You can also turn your phone in to get an upgrade. And have you thought about what about the data that's on there before you turn? Do you go to IT resources to make sure they wipe it? Those are types of things that we look at with smartphones, and we're bringing your own device culture. Who on your phone? Are you doing it yourself in this case as well? We're more mobile security policies pop up in organizations, in practices, and hospitals alike. Policies that look like, I know it's your phone and that's great, but accessing any of our information or communicating about any of our patients, you need to do things that will help secure your phones. One of these could be we're going to put a mobile device management platform, or connect to our mobile device management platform. It means they're going to put an app on your phone that allows them to check where it is using GPS. allow remote wiping of your phone if you lose it. We see posts popping up, such as if you loan, let the IT folks know, and they'll track it down for you. And if they can't, they're going to wipe your phone. This means really more than just killing for the data that's theirs. It means completely rendering your phone useless. So you're aware of what those are. A piece of it is pictures. You have a lot of physicians taking pictures. They're, just their physician for advice or a consult. You need to make sure that you have policies around what you do with those as well. So what about minimizing the risk by supporting a culture of compliance? If any other compliance program, it is important to have that organizational culture in place that supports from the top. We believe in security. We believe in protecting our patients' privacy, and going to do these ongoing activities throughout the year. We're going to ensure that we have someone who's responsible. We're going to look at our processes and across our regulations in South Dakota as well as federally. It's all pieces that need to be paid attention to. Ongoing. This borrowed from the Department of Health and Human Services Office of the Inspector General. They created these compliance programs goal for CMS for billing and coding, but out that they're really quite good and they apply to many types of compliance. When we look at what that means for privacy and security, we see privacy, the privacy officer, making it to the compliance committee, and they might, be the conduit between the security officer, who's often the technical manager or director of IT, and they coordinate together. That's the piece that's important here. I do another, I think I did this last year for South Dakota, called the HIPAA, where we look at if HIPAA were advanced, privacy would be the lead and security would be the follow. And it's a completely an appropriate statement, because we look at everything that we need to do with security, it's got to fall within the constraints of privacy. So when we give people access to electronic protected health information, we make sure we're following the appropriate use and disclosure and follow minimum necessary that privacy has outlined. When we look at incidents and breach response, we look at how we coordinate those incident response between the two. We'll look at coordinating efforts between privacy and security for training and compliance. It's all of the same types of activities. In fact, when you look at all of the different standards, we really see the opportunity for a more coordinated compliance framework regardless of the standard. We have committee oversight, and they're coordinating throughout the year when each of these activities is happening, and committee members that are responsible for the different standards. Important to support that culture. It's important to, by example, incident response. One thing I want to mention is that the types of incidents that we're seeing are getting more complex. We have to look at patient safety. Is patient safety also at risk? When, for example, the EHR folks having a particular module in an EHR, are they following the policies and procedures for testing? We had a case where We had one hospital was testing a pharmacy module, and they didn't have the proper test environment because that's what that particular EHR was providing. So the person testing from the EHR company decided to create a prescription or order a prescription underneath a provider's name for someone who's in the hospital. So that was a case where it was a near miss. The nurse caught the prescription from being delivered to the patient. But this we see security and privacy also starting to cross over with patient safety risk management. So it's very to be aware that these can happen, and go. That's total part of the prepared lecture. I wanted to make sure to save some time for questions. I think we'll open it up to questions.
Well, thank you. Some very good information. Certainly give us something to think about. Any questions for Trish at this time? Hearing, well, Trish, I do have a couple for you. One I wanted to ask you about. You had slides back. You talked about disposal of hardware or equipment, and that even if the data wasn't accessed by somebody still, or the federal government would still consider that a breach. And so could you elaborate on that a little bit? I mean, how do we find out? Would it be an issue that somebody complained or somebody identified the information, reported it? I mean, how would that work?
These can come from self-reported cases, as we're supposed to do. It can come from someone, in the cleanup crew had a question after the fact, or in that particular case, it was self-reported.
Okay. Well, I'm understanding that one of the best things a person can do when you go to upgrade a device or you go to dispose of a device is make sure you consult with an IT person, make sure it's completely wiped clean. Yes,
make sure you have it's included in a mobile device security policy that before upgrading or returning to a vendor, or to pass it by your IT resource to make sure that it's wiped clean.
Okay. The other question I had was, so often or anymore, so many people carry smartphones, and with a lot of your smartphones, you're encouraged to, on occasion, go online, and do a backup on them. And so if a person were to, access perhaps mail from a patient, or were to access some information via their smartphone, and then at the same time, they go home and they back that up, what are the recommendations you would have in terms of what you need to take into consideration if you do back that phone up at home? What kind of protections do you have to make sure you have in place there as well?
That's a great question. Yes, absolutely. So when we talk about your bring your own device policies, your mobile security policies, they'll also provide guidelines for how to protect your data at home as well. So it's have password on the phones. On backing up iPhones, for example, you can choose to encrypt them so that they're only restorable to that same phone or device. When you're upgrading a phone, it gets a little tricky, so you can manage that too. But there are options for backing up those. And if you're backing up your laptop to another backup, to that too. These are copies that are being copied all across your devices and network. And so making sure that you are using appropriate antivirus at home, making sure that you have a good firewall at home becomes important as well. There are cases where forensic investigators can go into an employee's home to investigate their owned devices and equipment. Those precedents have been set.
Wow, and something certainly for us to all think about. Questions for Tricia at this time? Hearing none, I do see that on your last slide you have your direct phone line up and you do have your email up. If upon listening to this program, if they were to have questions for you, can they contact you direct, or can they send you an email with questions they have?
Yes, absolutely. I'm happy to take questions. And, yep, if you can find me, you can ask the question. So I'm happy to do it.
Okay,
Reference
thank you.
the program, so let me know what you just listened to.
Thank you. One last call. Any more questions for Trish? Okay, hearing none, Trish, I certainly do want to thank you for being with us tonight and sharing this information with us. This information that you gave us tonight, and then Robert Thompson has done 2 informational programs for us regarding medical record documentation and privacy, which have both been excellent. And again, certainly give us a lot of things to think about in terms of risk mitigation in regard to medical practice. And so, again, I want to thank you. I want to encourage all members that participated tonight, and I want to thank you as well for participating. I know our next program that we're looking at hosting in this series is going to be set for August, and we're going to talk about patient communications. I know that that's going to be an interesting topic as well. And so I also say in closing, if you do have any questions, feel free to contact the Medical Association. The slide here does have Trish's phone number and email address, and so you can certainly contact her as well. First this evening before we close?
I don't. I hope everyone has a great evening or day if you're watching this throughout the day. And thanks for having me.
Okay, well, again.